So a biofilm is just a low-grade subclinical infection. It's a collection of bacteria that are living somewhere in your body, usually on something that doesn't have a good blood supply or has no blood supply. They hold hands, make a gooey coating, and hang out there. And what they end up doing is causing inflammation for normal tissue around it. So plaque on your teeth is a biofilm. You can get biofilms on breast implants. You can get biofilms on all different sorts of implants. So biofilms on breast implants in particular almost always are just skin bacteria, or they're bacteria that are in your ductal system within your breast that got on the implant during the time of surgery. And so these tend to be not like super aggressive bacteria that make a rip-roaring infection and put you in an ICU. They cause a biofilm. And so biofilms are really common on breast implants. Many women have zero symptoms from biofilm, but there are women that seem to. And in particular, certain bacteria have been associated with causing capsular contracture. So C. acnes is one of the common offenders. Staph epi, common offender. We see these things causing capsular contractures. Does every woman with a biofilm with those bacteria have a capsular contracture? No. There's a lot we don't understand about who gets capsular contractures and who doesn't, but biofilm certainly seems to be a problem. Another thing you'll hear commonly in the breast implant world is that biofilm on your implant will lead to symptoms like breast implant illness, or the current terminology, which is systemic symptoms from breast implants, or SSBI. Now, there has been some study of this, and it does not seem to be, but further study, of course, will need to be done. And there's always a possibility that you as an individual just don't do well with biofilms, and that was particularly the problem for you. It's hard to say we don't have good data that show an association. The best data we had shows no association. So what we do now in the breast surgery community is to try to prevent biofilms if at all possible. So we don't use a nipple incision, we use Keller funnels to place implants, we use specialty irrigants, and the capsular contracture rates are very, very low. Like the most recent study, I think the update from Allergan was like less than 2% capsular contracture rate. So we're doing a really good job preventing capsular contracture, and a lot of that is because we are doing a better job of preventing biofilms.